Hello again everybody, Jeremy Latham here, I'm the hip surgeon. This is one of my top tips for hips videos. I'm in my home studio today in the spare room. I've got a day off and I'm using my little GoPro camera to do these short videos. Today I want to talk to you about dislocation of the hip. This is the most feared complication after hip replacement surgery. If it's going to happen, it usually happens within the first few weeks after the operation, whilst the soft tissue envelope is still healing. It's often due to technical problems and sometimes due to patient factors if you don't follow the precautions you've been given by the physiotherapist and your surgeon. For my part, my dislocation rate is about 0.2%, which is low. The reason that is low is because I carefully plan my operations. I use the appropriate implants, bearing materials and techniques for you particularly. And we also have a very good team of physiotherapists and nurses, and me, of course, looking after your post-operative recovery, giving you appropriate advice so that you reduce the risk of having this major complication. The physios will give you very clear advice about what to do to avoid it. In particular, you must avoid twisting, so don't go into the garden and do weeding and digging and things like that whilst the soft tissue envelope is still healing, and that's usually for the first 6 weeks or so. You're often told that you must sleep on your back for the first 6 weeks. Again, this is to reduce the risk of you twisting over at night and getting the hip to come out of joint. I have to say, over the last few years, I've become much less anxious about patients lying on their back to sleep. I'm happy for you to lie on the operated side as soon as you feel comfortable. The other thing to do is not to get hold of the leg and pull it upwards in excess of 90 degrees. There'll come a point in the first few weeks after the operation where you find yourself doing things without even thinking about it. And this is generally for most people around about 6 weeks or so after the operation. After about 3 months, you'll pretty much have forgotten you've had surgery. So I hope that's been helpful. If you've got any comments or questions, please get in touch. This is again one of my top tips for hips. Thanks for watching. I'm Jeremy Latham and I'm the hip surgeon.